Good morning, madam. Yes, thank you, madam.
A very warm welcome to all. Today we are starting our session with a small clip on cancer awareness. Thank you for your kind attention. Honorable Director, Professor Satpute Sir, our eminent speaker, Dr. Rahul Chavan Sir, Surgical Oncologist, Ms. Vividha Raunekar Madam, Expert Scientist, IIT Bombay, Mr. Harris Punakal Sir, Advisor and Head, Department of Biotechnology, Government Institute of Science, Dr. Pramod Kamble Sir, Convener and Associate Professor, Department of Environmental Sciences, Central University of Rajasthan, Dr. Mayawati Patil Ma'am, Coordinator and Assistant Professor, Department of Biotechnology, Government Institute of Science, and all dear participants. I, Pooja Sanone, Organizing Secretary of Online National Seminar, express heartfelt gratitude towards all the participants on behalf of all the organizing members of our committee. In the world of professional gatherings and knowledge sharing, virtual meetings are formidable platforms that bring together erudite thinkers, visionaries, and scientists together. This virtual platform serves as a grand stage where ideas converge, collaborations are forged, and significant discourse is born. On World Cancer Day, we are merging our objectives of awareness and research into a theme that is cancer awareness and associated research elements, that is CARE 2024. On World Cancer Day, without wasting much of the time, we have planned two different sessions, which is going to be prominently focused on awareness and research. So, without wasting much time, we will commence our program. And for the welcome address, I request our advisor, Mr. Harris Panakal, sir, to kindly go forward with it.
Yeah, thank you, Pooja madam. Uh, First of all, a very warm welcome to all gathered here on this online platform. On behalf of the Institute as well as Department of Biotechnology, I congratulate the convener, Dr. Pramod Kamble sir, Associate Professor, Department of Environmental Science, Rajasthan University, for taking up this initiative and teaming up with them our department members, faculty members, Pooja madam as well as Mayawati Chavan madam for taking up this social issue of the cancer awareness on the World Cancer Awareness Day that is celebrated on 4th of February each year. This is a very important social message that we are trying to percolate from the highest level to the grassroots. So this is a very laudable effort that they have initiated on this date, that is the 7th. Before we go into the actual seminar, I would like to briefly introduce about the institute as well as the department. Government Institute of Science was established in 1974 and as an PG as well as a research institute. It has five PG departments, especially in life sciences. There are 4 departments: microbiology, biotechnology, botany, and biophysics, and there is one geology department. These all departments run PG as well as PhD courses, and over the years, many students have progressed on to make rich careers. And this is a department or an institute that is supported by the state government. It is run by the Department of Higher Education. Um, Sorry, I got disconnected. Hope I am audible to all the audience.
Yes, sir, you
Yes,
are.
sir. Yes, you are audible.
This is an institute that is directly supported by the Director of Higher Education, Government of Maharashtra. And over the years, the Department of Biotechnology has completed 25 years. It is in its silver jubilee year of completion. And we have many students of the department who have uh, uh, yes, I'm getting a call. Just a moment.
Okay, sir. No issues.
Yeah. Huh. So this department has given many students who have joined PhD careers and gone on to flourish. They have also become entrepreneurs. We have a very rich program where students are even helped in placements. Many students get placed all over the country as well as in different places in abroad. We have a students association which we call as GISA Biotechies, which is a students club. They organize many events. They organize events like 2 minutes presentations. They also have awareness events which is collaborated by the faculty members. Like recently we had one awareness event where e-waste awareness campaign was run for a week-long session as part of the institutional activity helped by the students club, as well as part of the 25 years of celebration of department establishment. Apart from that, our faculty members who have all got selected and got absorbed into the institute through MPSC process, that is Maharashtra Public Service Commission. And we have faculties who have their own domains of expertise. Dr. Rahul Bhagat, who works in molecular biology. We have Dr. Indrachan Gupta, who works in nanotechnology. We have Mayavati Chavan, who works in environmental pollution remedial measures. We have Pooja Madam, who work in actually e-waste remediations. So these are the faculty's expertise, and they are dedicated staff. They are young, they are motivated, and they help in carrying out the agenda of the government of having a quality higher education institute. As we are here today on the cancer awareness seminar, so this whole idea of this exercise is basically to percolate the awareness of the disease itself, which can strike anyone out of nowhere. So what are the causes, what are the diagnostic techniques that are available, uh, how early diagnosis can save a life, and what are the options that are available and types of diseases that are there, especially in the cancer area. That will all be addressed in today's national seminar. So we have very good speakers like Dr. Rahul Chavan, surgical oncologist from Tata Memorial Hospital, as well as research scholar from IIT Mumbai, Ms. Vividha Raunekar, so who would be guiding you all. So I congratulate all those who have enrolled to this national seminar, because you are becoming part of a awareness program that is a worldwide a significant event. So hopefully you will gain a rich knowledge by having this interaction today. So without wasting any more time, I would like to hand over the proceedings to Ms. Pooja Sonone Madam, and I'll thank her for giving me this opportunity to introduce the institute as well as the department and as well as about the program today. Thank you.
Thank you so much, sir, for your kind words. Now I request the convener of our program, Dr. Pramod Kamble, sir, to briefly introduce the event to all of us.
So good morning, all. Am I audible?
Yes, sir.
Yes. Good morning, all. So, respected resource person, Dr. Rahul, Ms. Vividha, Professor Satpute, Mr. Harish, Dr. Mayawati, and Ms. Pooja, and dear participants. So, I am a Dr. Pramod Kamble, and I'm convener of this particular seminar, and I belong from Central University of Rajasthan. Central University of Rajasthan has been established by the Act of Parliament, Central University Act 2009, and located in Ajmer district and operates through our own 518 acre of lush green campus, and we are running like 54 departments and we are having school system, and our department has been established in seminar on cancer awareness and associated research element 2024. As we all know, after the advent of industrialization and modern agriculture technologies, we are like basically suffering from various kind of the negative impact of that particular industrialization, and huge amount of dire consequences has been created by this particular industrial activity on the health of the human being. So in this, if you look at the research perspective, it has been explained by the Rachel Carson in her Silent Spring. The relation between cancer and pollution and biomagnification is of main cause of concern, and environmental pollution, including air and water pollution, as like can directly cause cancer or increase the risk of developing the various kind of the diseases. So additionally, the biomagnification of pollutant through the food chain and like can further maybe elevate human exposure to carcinogenic substances, and it is to implement crucial to implement measures to reduce pollution and promote sustainable practices to safeguard public health and prevent cancer related illnesses. So I hope that today's seminar will highlight this kind of the issues to create awareness for safeguard of human health and safeguard of the environment. Thank you very much.
Thank you so much, Dr. Pramod Kamble, sir. We will start with our session one, and for that I request Dr. Mayawati ma'am to kindly introduce our first speaker, Dr. Rahul Chavan, sir.
Pooja ma'am. Once again, very good morning to all the participants who are participated in seminar. Myself, Dr. Mayawati Patil, Assistant Professor in this Department of Biotechnology, Government Institute of Science, Chhatrapati Sambhajinagar. Again, on behalf of our institute and seminar coordinator, once again I again welcomes both of our speakers, Dr. Rahul Chavan and Dr. Vividha Madam. So it's again giving me a pleasure to warmly welcome and to introduce Dr. Rahul Chavan. Dr. Rahul Chavan is a well-known cancer surgeon in Mumbai and Navi Mumbai. After extensive training in cancer surgery from prestigious Tata Memorial Hospital, Mumbai, he completed his MCH super specialization degree in surgical oncology, that is cancer surgery under Homi Bhabha National Institute. With his merit, he has completed all his education from popular government institutes of the country. He completed his MBBS from Government Medical College Dhule and MS in General Surgery from renowned Institute of Postgraduate Medical Education and Research, Kolkata, under West Bengal University of Health Sciences. He has published several papers in various international and national journals and also presented scientific papers and posters in various national as well as international conferences. He was awarded with the first prize for poster at AsiaCon 2010 for his work on the breast cancer surgery. He has also worked in breast cancer unit of IPG-MER Kolkata for 3 years and got trained in oncoplastic breast surgery. He also worked in surgical oncology department at Asian Cancer Institute and Safi Hospital as clinical associate. His area of interest are breast cancer, then gynecological cancer, including ovarian, uterus, and cervical cancer, and colorectal cancer, that is the cancer of colon and rectum. He also treats gastrointestinal cancers, which is the cancer of stomach, pancreas, gallbladder, liver, and colorectal. Again, thoracic cancer, that is the cancer of esophagus, lungs, and meningeal tumors. Again, urological cancers, that is the cancer of kidney, bladder, testes, penis, and prostate. And against cancers of bone and soft tissues. He also holds the fellowship degree in minimal access surgery, that is FAMS. And with this rich and diverse background, his unwavering commitment to impactful life goals stands out prominently. His aspirations are nothing short of extraordinary, which includes fostering widespread public awareness about the common cancer. Second, to detect the cancer in early stage to achieve the successful treatment, and letting the cancer treatment to reach up to common people and help to common people to quit addiction, to prevent the whatever the to prevent the future cancer effect. Presently, he is working as a consultant surgical oncologist at Fortis Hospital as well as Tata Hospital in Mumbai. And with this brief introduction, I request Dr. Rahul to take upon this virtual stage and start his presentation. So, Dr. Rahul, please.
Good morning, all. Hello.
Yes.
I hope I'm audible.
Yes, you
Yeah.
are audible.
Yes, sir.
Thank you all for inviting me. So I'll just start my presentation and
Yes, you are audible.
yes, I hope my screen is visible.
Yeah.
So at the outset, I want to mention few things. Some clinical photographs, as a lay person or as a non-medical person, you might find it as a horrific or maybe disgusting. But the main intention of those photographs are just to make you aware about the facts. You may find that some repetition of some of my words or some of my statements or few slides. Again, this repetition is just to stress few facts and make you aware about the cancer. So today's topic is let's know about the cancer. In in subsequent my talk, mainly I will first let you know about how it's a burden of cancer in our society. What are the early signs and symptoms with which we can identify the cancer in an early stage, and what are the preventive modalities that may be utilized in order to prevent the cancer. So let's see about the statistics to know about the burden of the cancer. So see what various media says. Hindustan Times, World Health Organization, what it is saying, that this is a current report. This was published in just this World Cancer Day. So 1 in 10 of Indians will develop a cancer in their lifetime. So this is a very much significant. 1 in 10 means definitely some of our near and dear, maybe there is a very good chance there can be victim. 1 in 15 will die of cancer. So 1 in 10 or 1 will get a cancer, 1 in 15 will die of a cancer. So see what WHO say about the India. In India, there are around 14 per year, 14 lakhs cancer cases are detected. More than 9 lakhs people are dying every year, and prevalence at presently almost in 5 years around 32 lakhs cancer cases exist in 5 years. So these figures, these are very much significant. These are very much shocking. Yearly 14 lakh people will get a cancer, more than 9 lakh yearly they will die. They are dying in India. See these statistics in if you see about the male and female, so around more than 7 lakh 22,000, and females they are getting cancer every year. In males more than 6 lakhs 91,000. So females they are slightly more prone compared to the male. If we see the statistics about the male and female, what are the organ subtype in which cancers predominate? In males, as we know, in our India, this is a hub for oral cancer population, because we know from childhood we have been hearing about the tobacco cessation program and tobacco awareness. So due to this, in our India, male lip cancer, oral cancer, lung cancer, they are very much common in male, while in female the single largest cause of mortality or death from cancer in female is a breast cancer. So in my subsequent slides, I'll be highlighting about these common cancer: lip, oral cavity, lung, esophagus, breast. And in both sexes, breast, lip, oral cavity, uterine cervix, lung and esophagus, these are the common cancer. So again, see the figure yearly in breast, 1,92,000 patients, they get a cancer, while 98,000 means almost a 1 lakh. So
Rahul sir, I'm sorry to interrupt you in between. Your slides are not moving.
Yeah, just
I don't know, but I am presenting properly.
No, it is visible, but your slides are not moving.
it's not moving. So
I
make
don't
it
know
one
where.
slide from.
Rahul sir,
I don't know where I have got stuck. I don't know in which slide.
Yeah. Now
As
it's
per
moving.
Now it's there. You may continue, sir.
okay, then maybe in PowerPoint mode it is not
no,
visible. Just confirm me.
Rahul
Again,
sir,
I'm making a PowerPoint. Yeah. Hello. Hello. Hello.
Rahul sir, could you
Yes.
please
Yeah.
share your entire screen? Entire screen.
Yeah. I was talking on entire screen only. It's
You
on
Make it
shared entire
PowerPoint mode
screen.
only.
make it slide
Instead,
share कर चल.
Slideshow.
so instead of yeah, I mean slideshow. I was presenting through slideshow only. So okay, I'll just right now, is it visible? Tell me, is it visible and slides are moving?
Yeah. हो
Yes, sir.
visible है.
So again confirming. Now I will make a slideshow mode and confirm me the slides are moving. Are slides moving?
No, it is
Can
not.
someone confirm?
No, it is not.
So in slide somehow I if you compare the scenario of what in all over world, somehow we don't know precise mechanism. Maybe we are getting exposed to a lot of carcinogen, but our Indian scenario is almost parallel to the world. See now where we are, and by 2050 it is projected that almost will be the size of cancer will be double in the population. So with rising cancer incident, cancer remains a top 5 causes of death in India. 1 in 10 Indians will get a cancer in lifetime. 1 in 15 will die of cancer. And now WHO has suggested a theme on this World Cancer Day. What is the name of that theme? Is it close the cancer care gap? Now this statement, this word, it has a lot of meaning. Close the cancer care gap. So now a healthcare provider, a doctor, and a patient. Now there are a lot of factors that are contributing to increase this gap. Obviously, as we are a developing country, we know healthcare infrastructure, monitoring purpose, or accessibility to the healthcare provider. All these factors, they do matter in widening this gap. But the most important factor, what I see, though I stay in urban metro city like Mumbai, is a lack of awareness. So that is the most important factor. What is Indian Express is saying is In our country spends around 600 per person on cancer care, which is very low as compared to the high income countries. They spend around 70. So as I just raised it, our infrastructure does not allow us or does not provide us the enough screening modalities, but it is our duty, that it is our responsibility, that we should become aware about the common signs and symptoms, and we should become means we should have a less threshold to detect the cancer at early stage for ourselves and for our near and dear. So screening is, what is screening modality? We often get this term screening. Screening is a something modality when you don't have any signs and symptoms. That means you don't have any complaint pertaining to your body, but still you are going to the doctor or going to the hospital to get the test done. So that is the screening. Screening is not something that you have got some problem, that is pain in abdomen, or you have got some swelling, and that then you are going to doctor, then they are doing the test. So that is not a screening. Screening is something before, when you are completely normal in that situation, when you are going that, in that situation it is called as screening. So gap in cancer care is most important thing in gap in cancer care is a lack of awareness. Now, in simple language, let's try to know what is this cancer. So this figure highlights us the cancer. Normally, this, look at this. This is normal cells. Now, during its lifetime, the cells proliferate. It replicates. But when this proliferation, it replicates, it goes unchecked, it goes wild, then it becomes a cancer. That cells divides and divides and redivides, and then there is uncontrolled population of these cells. And look at this breast cancer. Then when there is a rapid multiplication of these cells, when there is a unchecked growing number of these cells, then they can migrate to other organs like a brain or liver or lungs. Then we call it as a stage 4 cancer. That is a metastasis. So stage 4 cancer or metastasis means that cancer which originates from particular organ, when it goes to a distant place, like breast cancer is going to brain or it is going to lung, then we call it as a metastatic. Obviously, in such a situation, it becomes almost incurable. There are certain modalities with which we can prolong the life, but becomes incurable cancer. So the whole intention of this topic is so that we can identify the cancer at early stage, and we can do something so that this cancer does not reach a stage 4. So we'll be seeing cancer of oral cavity, lung, esophagogastric cancer, breast and gynecological cancer. Now first let's talk about the oral cancer. As even any in India, any person, he knows that there is a wide prevalence of tobacco use in our India. So in male, this is the single largest cause, which obviously which is a preventable. We can easily avoid the tobacco. We can easily avoid the tobacco-related product like BDs, cigarettes, all these things. So this tobacco, it contributes to the formation of lip and oral cancers. It contributes to the formation of lung cancer, stomach cancer. So tobacco is responsible for almost some 49% of the cancer, almost for 50% of the cancer. This tobacco-related products, they are responsible. So this, look at this figure, so nice. This figure means it highlights the person from good family, having kids in white, but as he keeps on continuing his smoking exposure, obviously ultimately he also gets burned into the ashes. So tobacco use is almost accounted for around 3 lakh to 25,000 deaths in our India. So obviously this is a very much preventable factor. As I highlighted in my one slide, that our India means they spend very less amount of money in order for cancer detection or screening program, but at least this is in our hands. At least this, it is a preventable factor, avoiding tobacco. So tobacco contains a lot of carcinogens. There are some more than 200 chemicals that ultimately destroys our body. Ultimately, the smoke of tobacco damages the DNA. It damages the DNA, and from here the cancer starts. So how we can identify?
Just one moment. Just click on whatever
Slideshow.
links are given here. Na? Just click on that in mode.
Link. Slideshow.
Yes, slideshow, so that participants can view it in full screen.
But it is not moving. Again, I have clicked on slideshow, but slides not moving. Again, I will check.
Okay. If
Are slides moving?
it's okay.
Are slides moving? Are slides moving?
No.
Then slides are not moving when I click on.
Okay, then you can
Maybe
continue.
again, while sharing, maybe I should choose entire screen mode rather than window mode.
Okay,
So shall I try once again?
okay, continue with whatever you
Just a
will feel
minute.
comfortable.
Just a minute. Just a minute. Give me a minute. Is my entire screen visible now?
Yeah. It's entire screen
Are
is
slides
visible.
okay?
Yes.
Okay. Then
Yeah.
entire screen I should have shown
Yeah.
some rather than. So this is just a simple. So what we have to look for if someone is a tobacco chewer addicted to whatever the tobacco related product, maybe it is a BD, cigarette, gutkha, whatever. But any sort of lesion in the oral cavity, you should immediately go to nearby oncologist and get it evaluated. What we do, we usually take a small piece of that tissue that is called as biopsy, and we send it for a pathology workup. This figure shows that sometimes we find that we don't have any lesion in our oral cavity, we don't have any growth in oral cavity, but if you have any growth in the neck, which is a let it be a painless, still you should go to your clinician or your oncologist surgeon, whoever nearby you, and get it evaluated. This can be a cancer, maybe which is inside your oral cavity or in the throat, which is not visible. So this is one patient having advanced oral cancer. So this again, this young fellow, just last week only I met this person. So what is my intention of showing this figure is he is also young, 37-year-old, got addicted to tobacco when he was in a 10th standard, so around at the 15th year of age. Another mistake, so at very young age he got addicted to the tobacco related product. Another important mistake what he has, and he got diagnosed with the oral cancer some 1 year back. But despite that, somehow he became emotional. And we often, I don't want to criticize any pathy, but we should adopt some treatment. We should adopt something that is evidence based. He chose to take some only Ayurvedic medicines, and he had thought that with Ayurvedic medicine and yoga pranayam, he will try to win over his cancer. But see, in my practice or even in Tata Memory also, there are 10 to 15% of the patients who often they get misled. Some people say that Ayurvedic treatment is completely free of side effect, and they should have. There are people I have seen, they criticize Baba Ramdev or they want to sue him, but whatever you should do, it should be evidence based. This is a sheer example. This has happened with this guy, so young. Obviously, now in this situation, he is unlikely to survive for the next few months. So do something evidence based. Avoid tobacco. So what you should do, suppose if you are addicted to tobacco, you have taken tobacco related products for more than a decade, you should, in broad daylight, you should inspect your oral cavity, inspect your, this is we call as buccal mucosa of left side, right side, inspect your tongue carefully, this side, upper side, lower side, inspect it thoroughly. Just lift up your lips, inspect this part. So all this pink thing, what I am showing you, this we call it as a mucosa. This is a mucosa, this is a mucosa, this is a mucosa. So from here, these oral cancers start. Okay, this is the site from where the oral cancers they do start, and sometimes they infiltrate and they come out through the cheek, and then people go to the doctor when they find that there is something ulcer over the skin, but actually oral cancer start from this pink tissue. So if you are addicted to tobacco, daily inspect this site, or maybe at least once a weekly. And if any there is abnormality, immediately you should consult your clinician. And one thing important I want to tell you again, what is a field cancer? As you might have seen some of your near relative, they get operated for some oral cancer, and despite that, after some 6 months, after some few years, they do again develop a second cancer. So this is field cancer, as when you are addicted to some particular carcinogen, tobacco, smoke, whatever, that pan bitter, that that carcinogen, it gets mixed up in your saliva and it coats your entire lining and this entire surface epithelium, then it is prone for the cancer development at hello. Hello. The classical example of political leader Mr. Sharad
Samadhan,
Pawar
please,
sir.
please mute yourself. Samadhan, please mute
So he
yourself.
got 3 times he was operated for the cancer. So this is called as field cancerization. So in oral cancer, surgery is the most important treatment. There are, with advent of plastic surgery, there are now various reconstructive options are available. Sometimes people need a the radiation and chemo. There are few myths. At times patient feels that I don't have any pain, though I have some growth in my oral cavity. So it does not mean. If something does not hurt, necessarily it may not be that it's not a cancer. So most of the cancer they present in a painless manner. If you are not smoking, don't think that still you are not susceptible to cancer. Yes, there are 10 to 15% of the patient, despite they are not addicted to the tobacco, especially female, they can still get a cancer. At young age also, cancer can hit you. Cancer, I don't think that just I highlighted this fact that my oral cancer is gone. That means I will never develop a cancer. Cancer again, it can come back. And very often this question is asked, suppose in family someone gets a cancer, then sometimes they try to relative, they try to catch me apart from the patient, and they ask some question that whether it is a communication. So most of the cancers, they are not communicable. If you live life with a cancerous patient, if you eat with them or suppose some sort of contact happen, cancers are not communicable. And surgery is not painful, easily can be tolerated. Don't think that supari is a safe and only tobacco related product are harmful. Supari is equally, it can cause a cancer. E-cigarettes are also not safe. There is no safe limit for carcinogen. Don't go with any literature that okay, 2 cigarettes or particular ml quantity or particular percentage of alcohol is safe. Don't go with this such a guideline. There is no safe limit for any carcinogen like cigarette or alcohol. After that, now I will try to focus on the breast cancer, which is the single largest cause of cancer incidence in a female, and incidence as well as mortality in Indian population in females. Still a decade before, in our Indian population, in Indian women, cervical cancer used to be the topmost cause of mortality or topmost cause of death. But now the breast cancer has surpassed everything, and not only in metro urban area, but in also rural area also, it is the single largest cause. So just again to highlight the statistics, so almost 20 in female, 28% among all cancer, 28% it is the breast which is responsible, and same about the death. Almost 24% of the all cancer related death, breast is the responsible for 24% of the cases. Okay. So again, this is the repetition of slide. This is, you can search it on WHO website. Yearly 1,92,000 patients are getting diagnosed with the breast cancer, and 98,000 are dying. Almost means one in every second woman, one is dying because of breast cancer. Now, breast is such a superficial thing. So in our subsequent slide, I will highlight about the thoracic cancer or abdominal cancer, GI. But what is the thing that is becoming a problem about the breast cancer is women of around 45 or 50 years of age, they often get a breast lump, they often get some swelling inside their breast. But the biggest ignorance is it often presents with a painless matter. They never get a pain with this swelling. So that is the biggest cause of delayed presentation, that often ladies, women, they come to us and they often tell that they have been having this breast lump for almost a year or for almost 6 months. But lady who is at a 50, she is so much engrossed in her domestic duty, maybe related to her husband, children or grandchildren, and she keeps ignoring this fact. Okay, this is her clear explanation to herself that it is not bothering her, it is not painful, it is not giving her any fever, anything, any problem. Just leave it. And this is the exactly here we ignore the cancer, and this cancer grows from stage 1 to stage 4, and when they come at a stage 4, then obviously it becomes incurable, or at least they present with in stage 3, which is again still advanced despite the treatment modality. Then still they are bound to get a less life. So they find that in their ignorance they find it is a bliss. But as I'm highlighting, every one woman is dying of breast cancer among the 2, so we should try to present to clinician as early as possible. So in our India, almost 60% of the breast cancer, they are in an advanced stage and they die within a year. So what are the symptoms of breast cancer? Which thing we should immediately approach to the doctor? So any sort of nipple change, any sort of bloody discharge, any lump in a breast. So in my practice, this is the commonest presentation that I find, a lump in breast. They do get a lump in the breast, they get a swelling in the breast, they get a growth in the breast, but still they ignore. Apart from this, bloody discharge, nipple changes, or any change in the breast color, or any pitting of the skin, or there is a pain in the breast or nipple, you should immediately consult to the clinician. And these are the risk factor for the breast cancer that I will not go into detail. Gender, age, genetic factor, early menopause. Few important things. Genetic factors are very much important in our family, especially those who are blood related. Exactly what relation you have got, what relation with that relative. Suppose he is your paternal uncle, or he is your maternal uncle, or paternal grandfather. So exactly at what age, what cancer he got, and apart from him, again, what you are relating, they have got a cancer. I often see a patients when they have a strong family history. Their grandfather has some cancer, their maternal uncle has some cancer, or maybe a mother or father has got a cancer, and despite that, they are completely stay unaware at the age of 40 or 50. They present again in stage 4 disease. So at least this was, it could have been prevented. This could have been very much avoided. Nowadays, with the genetic testing, we can predict that maybe this patient is prone for development of this cancer, and this other percentage that he can develop a cancer, and we can very well adopt some lifestyle changes, or maybe we can subject him to some medicinal treatment or surgical treatment. We can avoid this. So genetic factor, knowing our family history of cancer is a very important. If you know that some of your family member, close family member, they had some type of cancer, immediately right now, this is a time, though you don't have any signs or symptoms, this is a time that you should consult to your doctor, and you should do some necessary test. So again, early menopause, family history, late menopause, exposure to radiation, obesity. I will highlight this fact again: lack of exercise, eating fatty food, hormone replacement therapy, not breastfeeding. Again, this urban area, this is very common practice. Women, they avoid getting married or avoid breastfeeding. So breastfeeding, it protects against the breast cancer. And late age of marriage and late age of giving birth to the child is also risk factor. So again, I'm highlighting this, where ignorance is a breast lump. Single important explanation women give us to us is that I do not have pain, and they keep bearing. Again, every one woman is dying yearly from two. So majority of the cancers will walk inside your body surreptitiously. So don't think that you don't have pain, or it is you can bear with this thing. So just see this fact. Why I was highlighting that women, they complain that they don't have pain. So in stage 4 cancer, if such a woman having a small breast lump, if she comes to us, there is almost more than 90% chance that with treatment, surgery, radiation, chemotherapy, there are chances that she will be cured of. There will be 100%, more than 90% that she can lead a normal life. But if she ignores that lump and she comes to stage 4, drastically the survival goes down. Drastically her chances of leading a life, her chances of surviving despite treatment, it comes down. So detect early, treat it better. So there are certain screening guidelines. I will highlight it later. Again, what is breast awareness? Nowadays, this concept is that if you search breast cancer, breast awareness. So in simple language, I will try to explain. Now, suppose if you are in your family, if you are close to your near and dears, if there is slight change in your mood, suppose if you are unhappy, you are happy, the person who stays close to you, immediately he will detect something changes in your face. Why he is able to detect it? Because that person is completely aware about you. That person is completely aware about your facial, about your mood, how you look. So exactly, every lady, they should become aware with their breast. So awareness, any slight change in their breast, maybe you should, all ladies, they should inspect themselves at least maybe monthly in front of camera, and any slight deviation in maybe a nipple or any size, symmetry compared to the both breasts. So they should be so much familiar that they know the way they are familiar with their own faces, they should be familiar with their breasts also. So be breast aware, so that any slight change, or if that cancer is coming in early stage, you can immediately pick it up and you can consult your doctor, and immediately the treatment can be started. So be breast aware. So what are the things apart from you can do? Examine your breast in a mirror, try to brace when lying down. So when the lady is lying down, against there is a hard, your thoracic wall is a hard because of the presence of a bony ribs. So when you are lying down, breast is a soft structure, you are very likely that there is a small lump, 2 centimeter or 3 centimeter. You can feel it. Suppose if you are standing, then there are very high chances that you might miss it. Again, when you are taking a shower, take this opportunity, and when you have a soap in your hand, it's a very this is a good opportunity to try to feel any sort of lump in the breast or in axilla. So remember one thing, that our brace is not something spherical or circular structure. It has got a tail inside this, what we call as armpit or axilla. So any surgeon or clinician, they will, if you have gone to get yourself checked for breast exam, they will always examine this armpit, what we call it axilla. So also we should also examine this axilla. So sometimes lady gets a sudden swelling here, but they don't have growth in breast. Maybe because of fatty nature of breast, they are unable to find any growth in there. So even if you have some swelling in axilla, immediately consult your doctor. So you can adopt any this method in order to palpate breast. Take your finger and go in this manner, in this manner, in this manner, or maybe you can go in a circular fashion. That you can find it on Google, YouTube, any method you find it out, and preferably once in a month you palpate your breast. Daily try to inspect your breast by taking a shower. What are the screening guidelines for breast cancer? Those who are having strong family history, the way I highlighted that maybe her mother had a breast cancer, her maternal auntie had a breast cancer, or maybe her sister had breast cancer, or even maybe her father had a breast cancer. In such a lady, at 25 only we should start screening, and for normal ladies at 40 we should start a screening, and there should be annual clinical encounter. Means you should see some clinician who are experienced in picking up the breast lesions early. So that is a clinical encounter. You should see a clinician. Then you should carry out annual mammogram. And again, breast awareness. Breast awareness I highlighted. What is breast awareness? The way you are familiar with your own face, in the same you should be familiar about your breast, how exactly both look. Okay, so this is a mammography. This is something X-ray of the breast. Okay. So obviously, it is breast cancer is very much curable, provided that it is detected early. Again, not every time that you will have to lose your breast in treatment of breast cancer. For any female, about a breast, obviously there is a lot of, for any female, breast is something when she is in society, it is very much a meaningful thing for her. Means many women, they fear that if they go to the clinician, if they go to some oncologist, their entire breast will be removed, that is mastectomy will be carried out, and then it will hamper her look, and then she loses her confidence that how she will go in the society. But no, especially in early stage, not every time you will have to lose your entire breast. There are various modalities and technique have evolved. We can do breast conservation surgery, that means we can remove that part of the breast, and we can again further, even if we have to remove the entire breast, maybe we can give still some shape, some contour, and we can still form so that she can confidently move the society. So there are techniques called plastic breast surgery. So breast conservation surgery, suppose she has got a lump here, so only that part we will remove. So that is breast conservation surgery. So again, some myths about breast cancer, that don't think that you don't have families, that means you are unlikely to get. Wearing a bra does not cause breast cancer, or consuming sugar does not cause a breast cancer. So as this is again common assumption or ignorance, I told you the lady has got a lump, but it is painless lump, so they feel that no, she did not go to the doctor. So no symptom, it does not mean that you should not go to the doctor. Yes, definitely. In 90% of the cancer, they present in asymptomatic manner. Okay, bigger breast size, higher risk. No, this is a myth. It does not occur in as earliest. I have seen the breast cancer happening in 20s also. So don't think that if you are about 45 or 50, then only you should be worried. It is not contagious, and this is for men also. That don't think that only females they get a breast cancer, and no, men they do have breast, and especially some genetic syndrome like BRCA1 or BRCA2. Men are also prone for the breast cancer, and the treatment goes in the same manner that treatment for the female breast cancer. So after that breast cancer, then we will try to see about something about the GI related cancer. So see, this is the esophagus, this is the stomach, this is a food pipe. Whatever we eat through the mouth, it goes to this food pipe, which is in the thorax, this is in the chest, and then it enters into the abdomen and it stays here. That is called a stomach. So this is we'll see these two cancer, esophagogastric cancer. So how do these cancers present? And what are the common etiologies? Again, smoking, alcohol, gas. This is a GERD, gastroesophageal reflux disease. I will highlight this point: gastroesophageal reflux, obesity, and age. So if you are elderly, if you are obese, obesity is very much problematic thing these days. Again, I highlight gastroesophageal reflux. This is what is. So often we see that, but after eating heavy amount, or we get heart burning, or we often say that we are getting acidity. So what is this thing? Our stomach regurgitate acid back into this esophagus. This is food pipe, and then we get some vague discomfort. We get burning sensation in our thoracic cavity. We get a burning in our chest, that we call it acidity. Okay, for few days it's okay, but if you have been having this for a long period, that means it has been there for chronic, then this acid reflux can induce a damage at this portion, and then it can cause a cancer. So this portion, this is esophagus, this is stomach, this is called as gastroesophageal junction. This area is vulnerable for formation of cancer, and many people, they die because of this cancer, because of just reflux of this acid. So you should adopt some healthy lifestyle, that means having high fatty food, having extremely spicy food, immediately lying down after having food intake. Like all these things contribute to the regurgitation of this acid into the esophagus, and it can cause formation of cancer at this area. So what are the common symptoms of this esophagus? That's food pipe cancer, regurgitation. If you are eating something but again it comes back, you are having weight loss, you have been having heartburn, you are having persistent cough, difficulty in swallowing, or you have any enlarged swelling in this neck area, or hiccup, or shortness of breath, back pain. Again, one important thing I will highlight: suppose if there is a change in voice, you notice that maybe till a month before, or till few weeks back you had a normal voice, but now suddenly for the last couple of weeks you find that your voice has gone hoarse. That means there is change in voice. So don't ignore such a thing: regurgitation, weight loss, heartburn, enlarged, something swelling in neck, hiccup, loss of voice, change in voice, back pain. So all these signs can be related to the esophageal cancer. Now the stomach cancer, how usually present? Again, this is one cancer present in the surreptitious manner. You will get a bloating, means immediately when you eat, you will find that, oh, your abdomen is full, you don't want to eat. So bloating immediately after eating. Again, heartburn, indigestion. Sometimes you get a gaseous problem. You find that you are getting loose motion. So this is such a sort of indigestion. All these can be subtle signs of serious gastric cancer. Lack of appetite, nausea. So this is a food pipe. Again, this is the stomach. This is gastroesophageal junction. How we usually diagnose? So if you have been having these symptoms for last few weeks or months, immediately consult your doctor. Get an endoscopy. Endoscopy is nothing but they will pass a camera through your food pipe and they will evaluate this tract, and it will be visible. Then they will take a biopsy. So this is about this esophagus and gastric cancer. So I was highlighting the repeated some symptoms. Bloating. Why again this finding? If you get diagnosed in stage 1, 5-year survival rate means that is 65% chance that patient will be cured. While if you get diagnosed late, then again there is very unlikely chance. In stage 4, the cancer survival rate drops to 0. So no standard screening modality for esophageal gastric cancer recognizes a vague symptom. Vague. This word itself has its own space. So all these symptoms, they are vague. They are not a distinct. You are not getting a severe pain. You are not getting a fever. You are not getting a blood in your vomitus. Okay? You are not having any sharp shooting pains. All these are vague symptoms that anybody can misunderstand these symptoms, and your cancer can go bloating, heartburn, indigestion, loss of appetite, nausea. So moving to the next cancer, which is colorectal cancer. Again, one of the commonest cancer. Almost 70,000 patients they get this cancer yearly in India. So this is called as our large intestine. This is a colon. This is ascending, this is transverse, descending, sigmoid, and rectum. So this colon and this small part is called as rectum. So they share some common feature. They have some common etiology. How do they usually present? This colon, when there is a cancer inside this colon, it often bleeds. Slowly there is a passage of blood in your stool, and you get a low hemoglobin, you get iron deficiency. At times it presents with a diarrhea or constipation. I'll highlight this line: diarrhea and constipation. If you are near your 50s, and sometimes for a few weeks you get a continuous diarrhea, and for some days again you get a constipation, don't ignore this. This is the commonest presentation of this cancer, and often patients, they lead with these symptoms, with diarrhea and constipation, for almost months and year, and they again present it. So if you are in your 50, don't ignore your diarrhea and constipation. It can be signs of colorectal cancer. Again, bloating, lumpy abdomen, pain, abdomen, blood in rectum, fatigue, tiredness, unexplained weight loss, black stool. Don't ignore these signs. So what are the recommended things to detect the for colorectal cancer early? We should do colonoscopy at least at 45 age onwards or at 50 once in a 5 year. So what is colonoscopy? Again, they will put a camera, this is scope inside, and it will evaluate this entire tract. If there is any growth, they will take a sample called a biopsy. So after this colorectal side cancer, now we'll see about the gynecological cancer. So in gynecology, so this is a uterus where fertilization happens and embryo development happens. This is uterus. This is called a fallopian tube. This is called an ovary. So in gynecological cancers, this ovarian cancer, this uterine cancer, and this end where the uterus opens into this vagina. This tract is called as vagina. Where uterus opens in vagina, this small portion is called as cervix. So this cervical cancer, endometrial cancer, we'll talk about this endometrial cancer, cervical cancer, and ovarian cancer. This cervical cancer used to be the commonest cancer. This is cervix. This is cervical cancer was the commonest cancer in our Indian females till a decade before. Now it has got surpassed with breast cancer. So now this ovaries enlarged. Ovarian cancer, around 70,000 will get affected yearly. The statistic 45% all 5 years survival. That means almost 55% of the women getting ovarian cancer, they are dying within 5 years. So what is the important thing what we are missing? Why these ovarian cancer patients they do not come to doctor in early stage? Because again it presents the vague symptom, vague. Again I am highlighting whenever I hear this word or whenever I'm reading this word to other people, I'm stressing this vague itself. It demands its own existence. It demands its own existence because this look at this. Now this lady absolutely she did not have any complaint. Okay, this is a patient having a huge ovarian cancer. So often these ladies they get a complaint, upset stomach, feeling immediately after eating even small amount of food they feel they don't want to, their abdomen is full now, they don't want to eat. So feeling full quickly, bloating, they will complain that I'm getting gaseous problem. They go for urination frequently. Means bladder capacity goes down, and in order to empty that bladder, they need to go to washroom frequently. So if you look at again these symptoms, all these symptoms are vague, but the importance is again almost 55% of women are dying within 5 years. So any who is above 45, if you are getting any sort of this vague symptom, immediately consult your doctor. We should get a scan and maybe sonography or whatever. Then if it is something, then we should try to treat it as early as possible. So upset stomach, feeling quickly, bloating, gaseous problem, or any sort of pelvic or abdominal pain, slight, though no matter how severe it is, even if it is a slight amount, immediately consult. So all these symptoms are very vague. The patient lady is not having sharp shooting pain, she is not having tremendous weakness, she is not having fever, but these vague symptoms, immediately she should consult her doctor. Cervical cancer, as I highlighted, this one second common cancer in Indian population. So here you can see there's something lesion. So how it will present? It will present through the blood will come inside the vagina. So any lady who is above 45, 50, if you are getting any sort of abnormal discharge through the vagina, immediately consult your doctor. Still, this is a very much common cause of death. Second commonest cancer in Indian female, a decade before it was a commonest, and our India represents 1/4 of its global prevalence of cervical cancer. Around there are 97 new cases and around 16,000 females, means women, are dying yearly due to cervical cancer. So cervical cancer, again, pelvic pain, bleeding, vaginal discharge. I highlighted this time. So any bleeding through the vagina or any sort of abnormal discharge, be it a mucoid, watery, immediately you should consult because this is present in that manner. Again, one important thing about this bleeding, I want to highlight that any sort of bleeding, suppose if you are getting a blood in your urine, don't ignore it. It can be a sign of your kidney cancer, it can be sign of bladder cancer. Blood in through your nipple, it can be sign of breast cancer. Blood in your stool, that is defecation. So don't ignore this. and always try to take a, don't feel disgust, but whenever you are facing flush button, try to have a look at your poop and don't ignore. If you find that staining on your stool, don't ignore, immediately consult your doctor. Maybe that is warrant a colonoscopy. Okay, so cervical cancer symptoms are pelvic pain, bleeding, vaginal discharge, bladder issues, back pain, leg swelling. These are the recommendation for cervical cancer. You should consult your doctor. You should get a PAPS testing done. I cannot go into the detail to the constraint of time. This is a PAP testing. That means your gynecologist or clinician, they will collect some sample and they will send it for the testing. So one woman dies of cervical cancer every 8 minutes in India. Such as severe this issue is after breast cancer. Cervical cancer, don't ignore per vaginal bleeding. I just highlighted, right? If you are around 50 or 45 onward, don't ignore any sort of per vaginal bleed. Then coming to the lung cancer, this lung cancer is the commonest global cancer. So single largest cancer which is responsible for to kill the human population is the lung cancer. This is goes globally across and for both sexes. So again, this presents in very vague manner. Lung cancer every year, some new cases around 70,000 and almost deaths is also. So if you see, there is no much difference between the new cases and deaths. So this cancer is a very much lethal cancer. Often it gets detected in late stages, but one good thing is that means again the single largest cause for this cancer is a smoking. This is also almost 80 to 90% smoking is the cause for this cancer. So again, we can quit the smoking. Apart from smoking, second-hand smokes. So don't think that in your family, suppose only male who is taking smoking, but his near and dear ones, his children, wife, they are also equally at prone due to his smoking. So second-hand smoke is also dangerous. So again, family history, dietary factor, exposure to radiation, COPD, if you have been having lung-related problem for so many years, even in TB, again, you are prone for the lung cancer. So how again it presents? It presents, commonest presentation is a cough, shortness of breath. You feel tired. You get occasionally you get a bleed in your while coughing. You find a bleeding. You get a chest pain. Okay, again lump in the neck. I told you in the neck any sort of swelling is you should consider. Loss of appetite, weight loss. All these can be the signs and symptoms of breast cancer. So how it can be diagnosed? Screened. Sorry, not diagnosed. Screen is a low dose CT scan. Unfortunately, this screening modality is not available in our India as our India. We cannot run the such a because it adds cost to the population and it becomes too costly. Low dose CT is a modality that which we can screen the lung cancer. And just again to highlight, when it goes to the distant, when this lung cancer is spread, it becomes stage 4. Only 7% they can survive till next 5 years. While it is localized in stage 1, there are 65 to 63% they can survive. So again, highlight we have some signs and symptoms. Immediately consult with the tobacco or with the smoking. Behavioral risk factor, tobacco likely account for 27% of the cases in India. So this is thing at least we can overcome. So if you and most of the time this tobacco related addiction starts in college life when you are around 10th 12th or near completion of your graduation. Exactly at this age only you get addicted to this substance. So this is responsible for 27 to 28% of the cases in our India. Apart from this, behavioral risk factors, behaviors mean that means something we can modify. So obviously we can quit the tobacco, we can improve our body weight, we can reduce our body weight, we can avoid alcohol, we can adopt a healthy diet, and lack of physical activity is very much responsible for cancer. So we can adopt a healthy life, so we can do exercise. So avoid this tobacco related product. So alcohol is responsible for these many cancers: mouth, throat, larynx, esophageal, breast, liver, bowel. So this is modifiable factor. We can quit the alcohol, adopt a healthy lifestyle, and calculate your own body mass index. See what is your weight, what is your height in centimeter, and with this formula, weight and height in centimeters, calculate your own body mass index and try to have it below 25. This is ideal between 18.5 to 24.9. So try to have your body mass index between this. COVID is over, but this is the biggest pandemic right now is going on. We are not aware, but this is the very much responsible for killing a lot of human population in the world. Not only this obesity is responsible for some more than 15 types of cancer, but it makes you prone for diabetes, it makes you prone for the blood pressure, it makes you prone for develop myocardial infarction that we often call as heart attack. So this obesity is a global problem. This is a silent killer, and many people are getting affected. Don't become overconfident you are not obese. Just calculate your body mass index. If it is less than 24.5, okay, you are obese, and you should improve your behavior. So obesity is another ongoing pandemic. What are the cancers associated with obesity? Thyroid, breast, liver, gallbladder, upper stomach, pancreas, colon, rectal, ovaries, uterus, kidney, blood cancer, esophageal cancer, meningioma. So these many cancers are responsible for obesity. As I told you, apart from obesity, apart from cancer, obesity makes you prone for the heart attack, blood pressure, diabetes. So avoid this something salted, processed food. Avoid this food. Avoid a red meat wherever possible. Avoid high energy calorie drinks. Avoid salted and processed food. Adopt healthy lifestyle. Food rich in antioxidants, vitamin C. How does exercise help? See, exercise increases insulin sensitivity, exercise decreases your fat, exercise increases your myocardial function, exercise decreases your inflammation, it increases your muscle mass. But exactly for cancer formation, reverse is needed. So if you have low insulin sensitivity, it makes you prone for cancer. If you are high lipid, if you are high fat, if you are more obese, then again it makes you prone for the cancer. So exercise is completely opposite to the cancer. So if now suppose if you have got a cancer, it does not mean that immediately you should start exercising. You should consult to your doctor, but as a healthy lifestyle, immediately start this adopting this exercise today only. So exercise is a very much such a thing that we can prevent a lot of cancers and again diabetes, blood pressure, myocardial infarction, such a things. Exercise help control your blood hormones. It reduces the exposure to the colonic carcinogen. It prevents the formation of these cancers, colorectal, endometrial, breast cancer. So take home message is change behavior. So these are the behavioral risk factor. Okay, so smoking, alcohol, tobacco, we can easily quit. We can adopt a healthy diet. We can control our obesity, exercise, and this is most important thing. Maybe other people they won't highlight, but this is a very much needed. We try to have good health insurance. These days, the treatment cost is so much high that even there are few drugs that their cost is goes to month. Single drug cost goes to 1 to 2 lakh. Even many rich population they can't afford such a costly treatment. So try to have good health insurance and know your family history. I had already highlighted this. So in your family, especially who are your blood relative, in your ancestry, try to know who had what type of cancer. Make a chart and immediately consult your doctor. Maybe you are maybe the next target, or maybe someone is your near and dear, they may be the next target. So don't ignore your family history. Listen to your body. Cancers, they always present in a surreptitious manner. They will enter your body in a secret manner only. So if you have any abnormal swelling, if you have abnormal, if you have persistent cough, difficulty in deglutition, difficulty in swallowing, you have change in voice, bleeding, highlighted this by bleeding in your stool, vagina, nipple, sputum, vomitus, don't ignore this bleeding. If you are non-immune, you are having some view of maybe it is a small fungal infection or maybe some scratch, eczema, maybe allergy, don't ignore that. It can be a cancer. Loss of weight, loss of appetite, hyperacidity, we often say hyperacidity. And I am repeatedly saying this, it's colorectal cancer, but they try to give you some important message, but ignores. Listen to your mind. There is something immediately you should catch these vague signs and symptoms. Constipation, don't ignore. This is just an example. A year back, I had seen this gentleman, 55-year-old, and he had this swelling. Almost 3 years he had been having this swelling. Unfortunately, when he had presented me, he had this lesion. And everybody, all the clinicians who saw him, everybody, they were evaluating this lesion, but nobody looked at his toe, that he had this small lesion. So actually, this was a father. This is a nothing. This was a small cancer over his toe, and almost he ignored this thing for 3 years, and this was his presentation. It had gone his thigh, it had gone inside his abdomen, and very soon after his diagnosis, when I saw him with this presentation, he died. So just I'm highlighting. So you have any small, it is a, though no matter means people, maybe some clinician will label it as a allergy or something, fungal infection. Don't ignore that, can be very much serious illness. So stay alert, hit the alert button immediately, consult your doctor, and remember, cancer is very much curable. And we definitely we have fear about this illness, but it is a curable thing, and not all cancer they behave in the same manner. So there are like a testicular cancer or thyroid cancer, they know their treatment responses are very good. But cancers like lung, pancreas, despite the treatment, often we lose the patient after a year or couple of years. But still, if you have some vague symptom, immediately consult to your doctor. If you have some family history, consult to your doctor. If these cancers are detected in an early stage, as I showed you in early stage, how are the results? So it can be curable. So thank you.
Thank you, Rahul sir. We can take 2 or 3 questions. A couple of questions can be taken. If any participant is having any question, you may ask.
Yeah, Mohammed sir, you can raise your question. Just unmute yourself and ask your question quickly, please. Mohammed sir, do you want to ask any question? Okay.
Any other participant who
Hello?
wants to ask question? Yes,
Yeah,
yes.
yeah, sir.
Hello,
You are
sir.
audible.
I am audible.
Yes, sir.
Yes,
Sure.
yes,
Uh,
yes.
sir, we are using X-rays for diagnostic any bone injury and other. So, may it cause cancer?
Very less chances, very less chances. See, even mammography, theoretically, if you go, then mammography, during mammography also there are chances of cancer formation. But this radiation exposure is a minimal, and this is just one-time exposure. So don't think that practically you should take it as don't know. Theoretically, there is a risk, but don't go in that way. Maybe the less incidence will be 1 in a lakh. But whenever we are advising X-ray or mammography, the benefit is far more. Even CT scan, we see CT scan getting done for various illness. So CT scan, any sort of radiation exposure has got something to do. Radiation has got something to do with your DNA injury. But don't take it in that way. Whatever we carry out the procedure, X-ray, mammography, or CT scan, whatever, they are for some benefit to diagnose the illness. So practically learn it as a no. Theoretically, yes, there is a small, very small amount of chance.
Okay, sir.
Anyone else? Anyone else who wants to ask a question?
Hello.
Yes, Akash, you may go ahead.
Sir, is there any types of breast cancer? It is. Sir, you are not audible. You are on.
Hello. Hi,
Yeah.
you are asking something
Yes.
about types of breast cancer.
Yes.
Yes, there are various types of breast cancer, what we call as a ductal adenocarcinoma, lobular carcinoma. But we don't have to go into detail that 90%, 5% what are the common things that we encounter clinically that I have highlighted. So again, by pathology wise, there can be various types of breast cancer. Like even it can, there may be lymphoma, there may be neuroendocrine tumor, there can be sarcoma. But important thing is, as a common in general population, you should be aware that if there is any sort of growth in your breast or any lump that we call, immediately a lady around 50, she should consult. As I highlighted repeatedly, the biggest biggest problem is it presents in a painless manner. They don't get a pain, and here we mistake it and we lead a life with a cancer for months and year, and often it presents in a late manner.
Thank you.
Excuse me. As we are running our YouTube streaming again parallelly, so there is one question from our YouTube uh, participant. So he is asking a question to Dr. Rahul that, sir, at which stage obesity can cause carcinogenic? At it was curable or not? So it is the question. So can you please satisfy him?
So obviously we cannot put a demarcation line exactly about the obesity. Important thing that I told you, you calculate your own body mass index. Suppose you study your body mass index for 25 and today it has 124.9. It does not mean so. So obviously such a thing, obesity or having high fat in your body, it causes cancer or even diabetes, blood pressure, kidney related problem, heart. So it cannot cause in a single moment. Gradually it affects a certain organ. In the same way, gradually there are certain changes in DNA and ultimately it can cause cancer. So there cannot be any single demarcation line. Important thing is you should try to keep your body mass index within whatever is recommended, 18 to 24.9. I hope I have answered your question.
Yes,
Could you please
yes,
repeat?
yes. I hope, Shvetang, you may receive your answer. Thank you.
Hello.
Welcome, Dr. Vanzaradkar, sir. Good morning,
Yes, sir.
sir.
Yes,
Yes.
ma'am. Good morning.
Yeah,
Good morning.
yeah, yeah.
Actually, I was listening
Yes,
on YouTube.
Okay, okay. Thank you, sir.
So
Oh,
this
sir.
link has been shared by Harish sir. So
Yes.
actually, I have a question. I heard a
Yeah,
lecture,
yeah. Please, please,
uh,
sir. Please raise your question, sir. Please.
and I have a question. I was
Yes, sir.
listening on YouTube.
Sir,
So,
yeah.
so the question is, the patients don't know what are the different symptoms about the cancer. Sometimes doctors also don't know. And doctors go on treating. If they don't know, they don't send to the specialist. And once the prescription is given by doctor, patient is following and continuously following 1 month, 2 months, 3 months, and later on they say no, 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 this is not the proper treatment. You should go for the so and so other treatment, and you should go for the specialist, like that. And the time is increased, time is lapsing, and finally they have been patients have been sent are being sent to the different government hospitals or cancer hospitals, and there they are too late to treat it. And even there also they go on giving the treatments, and they don't get give the confidence to the patients. And because why I am telling, I have two examples in our family that they lost their life because of such treatments and misguidance by the doctors itself. So I have strong objection that if the doctors don't know the treatment, they should not give misinterpretation of the diseases to the patients. They must give the confidence to the patients and proper treatment. If they don't know, they just say, I cannot handle the patient. But
Yes, sir.
doctors doesn't do this.
All are
Doctor
against
doesn't do this.
prevention, sir.
I have lost two members of family,
Yes,
so that's
yes.
why I am saying.
Yes, sir.
And
Yes, sir.
and even it was noticed too early. Despite that, we could not save them. So this is from, as you said, sir, that there should be awareness. But I object that awareness should be in doctors also.
Yes, sir. Yes.
What do you think, sir?
Exactly. This is very much common in my practice. So I will give you an example. The rectal cancer, I told you, patient will be present with a blood in stool. I just one statement also, don't try to have it's very much common that having some alternative medicine degree, they often think that this is something piles, and they go on treating, especially from the UP, Bihar, Jharkhand side, and often then after some few months later, then they realize that no, it was never a piles, it was related to the rectal cancer. So, but at least what we can do, there are with the same degree now government is giving MS for the allopathy, also MS for alternative medicine also. So here we cannot put a demarcation. It is something beyond. But it is our duty that we should stay aware and we should find a appropriate doctor. This is our duty. Now at least this something I cannot make a change in the system, but only I can make you aware.
No, okay, at least you can arrange some campaigns publicly.
Yes,
Definitely, I
okay,
would.
okay, sir. Your
Definitely,
suggestion
I
will
would
be
like
definitely
to.
considered. Okay, okay, sir. So,
Because family suffers because of such misguidance.
Yeah, you sound to be victim. That's why you are saying this thing. Obviously,
Thank you, sir.
okay, thank you, sir. Thank you, sir.
Zenith, you want to ask a question?
Yes. Am I audible?
Yes, please go ahead.
My question is that does presence of hemorrhoid has any kind of association that it will increase the chance of getting colorectal cancer? And how can we differentiate that it is a
no.
cancer or it is just a hemorrhoid?
No, first, hemorrhoid, it cannot cause a cancer, but this is, as I just highlighted, some in my practice, in some 15% of the patients, I find that they get mislabeled as having hemorrhoid. So, obviously, it is a clinical examination. You need to see some good expert clinician. It may be a cancer, obviously. A patient cannot differentiate between the hemorrhoid and cancer, but especially the people having alternative degree of medicines, though they are postgraduate in that medicine, I find that often they mislabel it. I'll just suggest try to see some, especially who has surgical oncology background. If you have some doubt, just consult with them and let them do what is called as digital rectal examination, whoever for your near and dear, and let them see from their point of view. Hemorrhoid, obviously, it has certain signs and clinician can diagnose this, and cancer definitely it has some other signs, but the person having alternative medicine can mislabel you many times.
Okay. But how can a normal individual like make a difference? Because the symptoms are the same. Because in both in colorectal
Maybe, ma'am,
cancer and in
as a
hemorrhoid,
person, as a person, this is a colon and rectum anus. It's inside the lumen. It is not possible for a normal person or patient to differentiate it. It is not possible for say to do a digital rectal examination. And obviously, if you don't have a clinical background, that particular subjective feel is there for you. It gets to your finger that if there is abnormal, that it will give to the some feel to the clinician to his finger. And hemorrhoid, it has another feel. And about the symptom, why usually hemorrhoid, it bleeds suddenly before your defecation or after your defecation. You will get a splash of blood, that sudden splash, just like a fountain of blood you might get on your pan of toilet. But cancers, they will present, but it won't be like a fountain like thing. At least this thing you can see on pan. About a clinical examination, as a general means, obviously, I don't think clinical examination can be, it is done by clinician. You need to see some surgeon or oncologist.
okay, sir, got my answer. Thank you.
Thank you, Zenith. I think we'll stop here.
Yeah.
Okay.
Yeah, thank
I
you so
take
much.
this, yes. Let me conclude, sir. You have been amazing and you have answered all the questions so brilliantly and with full patience. I take this opportunity to conclude session one of this program. Rahul, sir, your significant contribution and expertise in the field of medicine as an oncologist has reflected in your expert talk. We truly appreciate your valuable contribution that has indeed helped in spreading cancer awareness among all of us. On behalf of all the organizers and participants, we express our gratitude towards you for being a beacon to guide us through today's invaluable insights about cancer. Thank you once again, sir.
Thank you.
Thank you. Okay.
Let us now move towards our second session that is more of research focused. For this, we have Ms. Vividha Raunekar, ma'am. She is a research scholar from IIT Mumbai. Her research thesis is entitled as Probing the Crosstalk Between Metabolic Plasticity and Invasion Plasticity in Breast Cancer. She has worked as a full-time research scholar in Cellular Biophysics Lab, Biosciences and Bioengineering Department, IIT Bombay, and submitted her thesis in December 2023. She also has an experience as a teaching assistant for Neptil online platform, IIT Bombay, where she has served in the area of biostatistics and research data analysis, genetic engineering, and laser scanning probe microscopy. She has received DST Inspire and Graduate Excellence Examination Scholarship. She has worked on multiple projects that involve cancer, cell crosstalk, biophysical properties of cells that lead to the change in choice of mode of migration. Also, one project is focused on metabolic constraint that modulates surface glycocalyx of cancer cells and its consequence on cell metabolism. She has an expertise in cancer cell line culture, cell freezing, thawing, and passaging. Also, cDNA synthesis, RT-PCR, transfection, gelatin zymography, live imaging, multi-channel imaging, FRAP and FRET, and also atomic force microscopy. Apart from academic excellence, she has also qualified Japanese language proficiency test level 5. We indeed have a versatile and a dynamic speaker in research, Ms. Vividha Raunekar. I request Ms. Vividha Raunekar to kindly take over the session.
Thank you very much, ma'am. Am I audible?
Yes, you're most welcome, Vividha.
Yeah. So I'll share my slide.
Yes.
Is my presentation visible?
Yes, yes, it is visible.
So first of all, welcome all uh, for this wonderful seminar. Uh, so first of all, I would like to thank Professor Pooja ma'am and Professor Pramod Kamble for inviting me for the lecture. So we are having this session on the occasion of World Cancer Day, which happened on 4th of February. The session is entitled as Cancer Awareness and Associated Research Element. So I will be presenting more towards the cancer research part. So Pooja ma'am asked me to present like in like for the students, they should be able to understand what is the cell culture, what are the techniques. So I want to show one or two couple of videos which will focus on how the cancer cell culture is performed and what is the significance of cell culture. So I would like to just know whether the sound is okay. Ma'am, can you see this?
Yeah,
Yes,
yeah, yeah.
it is visible.
Visible and your sound is also audible.
Yes.
Yeah, full screen is also visible now.
Okay, thank you.
Thank you.
So this video will focus on what is the significance of cell culture and how it is done. And the next video will focus on what are the precautions to be taken while doing cell cultures and how the techniques are performed while doing the cell culture.
Excuse me, Vividha madam. Vividha madam, can you click on that hide icon so that
Yes.
participants? Yeah, so
Vividha, there isn't any sound also. Is sound
Yeah, there
important
is
in this
sound.
video? Is it
No.
important to see this video? Because the sound is
No.
not there. If any setting is needed, please, can you do it quickly?
Just let me know if it is audible. Is it audible now?
Yes, I think. Yeah.
Yeah? Okay.
Make it full screen, please.
Yeah.
Vida, as there is no sound, will you please explain the slides in short? Because there is some problem with the sound, I think. And also press the hide.
Okay.
So, you know, this,
Yeah. Okay.
okay? So you can just narrate whatever is there on the slide so that it becomes more easy for the others to get an
Fine.
understanding of the
Fine.
slide. Okay?
Okay.
Thank you.
Okay.
Yeah.
So these are the culture ware used for the cell cultures. And we culture cells in different culture medium. That is the food for the cells. And it consists of different supplements like lipids, growth factors, and it is added with the medium. So major component we added fetal bovine serum, which is derived from a bovine fetus, and the composition is not known. So so with the different fermentation and combination, we prepare different kinds of media for different types of cell culture. So apart from that, we maintain a particular pH for the culture media. So around 7.2 pH is used for the mammalian cancer cell culture, and the pH ranges from 7.2 to 7.4. We add sodium bicarbonate for alkalinity of the culture medium. So there are different commercial medias can be used like DMEM, RBMI, F12 medium. F12 is usually used for the primary cell cultures. It is very important to use an appropriate culture medium at appropriate temperature and CO2 concentration. For mammalian cells, we use 37 degree. For that, we use incubators. So it's very important to maintain a sterile environment while doing the cell culture because there are chances of contamination by bacteria, fungi, and mycoplasma. So for that, we use a laminar flow hood for the cell culture. So there are chances of cross-contamination. For example, if you are using different hello.
Yes, I think we lost you in between.
I
Yes,
got disconnected, I guess.
yes,
Yeah.
yes. You
So
may
ma'am, at what point I
no, just I think a minute before.
yeah, okay. Anyway, that video got over. So it basically described what how cell cultures are maintained in different countries.
I think we have lost Vividha again. Kindly be patient till the time she gets reconnected with us.
Hello.
Yes, yes, Vividha.
Yeah, welcome again, Vividha.
Can you see the screen?
You have to share the screen first.
Is it visible?
Yes, it is visible now.
So in this video, we'll look at how cell culture is performed in the laboratories. So these are the culture dishes. Uh, and in these dishes, the red color is the media. The cells are stored in minus 186, that is liquid nitrogen. And then they are thawed in the dishes and then they are cultured continuously. So this video will show how the cell culture practice is carried out. So these are the different medias that are used, and these are the incubators in which cells are cultured. So first of all, we have to clean the hood. So maintaining sterility is very important during cell culture. So these are BSL2, that is Biosafety Cabinet 2 facility, which are used for mammalian cell culture. whereas VSL-3 facility is used for viral cultures. So you have to make all the reagents, pipettes, and tip boxes accessible to your hand. Clean each and everything which is present inside the tube with help of 70% alcohol. Am I audible?
Yes, you may continue.
Yeah, yeah, I'll continue. So whatever reagents we will be using, you have to spray it with 70% alcohol, and then only you can take it to the tube. So in order to maintain the sterility, you have to open all the reagents or the tip boxes inside your tube. These are the tips along with the packets. So uh, you have to maintain sanity while you are doing the cell culture. You have to wear gloves, apron. Uh, you have to cover your hands. So in order to avoid contamination, you have to avoid these things like coughing, sneezing in front of the incubator or the food. So this is the incubator where cells are kept at 37 degrees Celsius. So how to detect contamination? The media can get turbid or the cells morphology can change. So these are the microscopic images of the cells. Yes, cross-contamination is a common problem. This is advice that you should work at a time with one cell line while doing the cell culture. When you are handling multiple cell lines, you have to dispose the common tips you have used or the gloves you have used. Then you can use two different cell lines at one time. Yes, you have to routinely screen your cells for the contamination. And for mycoplasma contamination, you can do RT-PCRs. So this is a culture plate, and the person is adding media to the plate. So you can store your cells in the liquid nitrogen, and when you want to do the cell culture, you can thaw them and use them. So basically, you can call this as a freeze of the cells. So this is how you have to label cells. That is cell line, passage number, date, on which date you have thawed those cells or stored those cells. This is a common practice of cell culture which everyone has to do. So you have to be very careful while pipetting the media or while adding any reagent to the monolayer of the cells, because cells can get detached. When you are growing a monolayer of the cells over the glass surface, you have to properly mix the cell with the media and make sure it spreads over the surface very evenly. So it's done for the videos. Am I still audible?
Yes, you may continue.
So this was about the cell culture and how the technique is performed. What are the important things you have to follow while doing the cell culture? So now I'll be presenting my thesis work. I have been doing my PhD since last 6 years at IIT Bombay in the cellular biophysics lab. So my thesis title is Probing the Crosstalk between metabolic plasticity and invasion plasticity in breast cancer. So what happens in cancer? So I'll briefly go through the cancer metastasis process. So uh, so the cells at the primary tumor site, they lose their polarity, cell-cell polarity. And on the onsets of different uh, oncogene activation, tumor suppressor gene deactivation, cancer cell can form. Those cancer cells can divide and form a primary tissue, or say that primary tumor cell. This cells from the primary tumor
Vividha, I'm
cell.
sorry to interrupt you. Your voice seems to be low. There isn't clarity in the voice, so yeah.
Is it okay now?
Yeah, it is okay, but I hope the sound, your voice isn't low. That's it.
Okay. So now is it fine? I think it has reached its limit. Is the voice okay now?
Yes, your voice
Hello?
is, yeah, yeah.
Okay. So, so this is the procedure of cancer metastasis, where cancer cells invade from the primary tissue site to the bloodstream, called as intravasation. And in the bloodstream, these cells migrate to the distant sites. And to a distant site, the cells breach through the blood vessel. They go to the other site and they start homing to other site. So, for example, if someone has tumor in lung, the cells from the lung tumor site can go to the different parts of the body, like bone or colon, etc. And this is how, if someone is detected with the cancer, they can one type of cancer, they can have different type of cancer as well. So my PhD work focuses on how to avoid this process, like how to avoid migration of the cells from one tumor site to the other. So it has been shown that cancer cells, in case of cancer cells, the tumor stiffness increases. For example, in case of breast cancer, the tumor stiffness increases from zero point 0.5 kilopascal to 5 kilopascal. And this is because of extra deposition of collagen as well as its cross-linking. So apart from that, cancer cells exhibit different metabolic pathways as compared to a normal cell. So in cancer cells, the motto of cancer cells is that they have to divide faster, they have to synthesize more of the biomolecules like amino acids, fatty acid, NTPs, as well as they have to maintain the energy balance. That is why they reprogram their metabolic pathways as opposed to a normal cell. So it has been shown that there is a crosstalk between substrate stiffness and the cancer metabolism. And we, in my thesis, I have looked at how this crosstalk helps cancer cell progression. So my question is, how does glucose constraint and matrix stiffness affect invasive phenotyping cancer cells? So we hypothesize that stiffness-dependent metabolic reprogram is essential for sustaining tumor growth and cancer invasion. So I have cultured MDMB231 cancer cell line, which is a TNPC cell line, on three different glucose condition media, that is high, low, and low, and on two different stiffnesses, 0.5 and 5 kilopascal J. So these are the cancer cell images, and we have seen that on 5 kPa cells are spreading more and they are elongated in no glucose condition as opposed to high glucose condition. And they are migrating. So these are the images obtained from tracking of the cells for 12 hours. And we looked at how long they have migrated from their original position. So we have seen that on 2D surface, cells are migrating more under no glucose condition. So this was our surprise that under even in absence of glucose, cells are migrating more. So the next question we asked why there is change in phenotype under high and no glucose condition. So we stain cells with focal adhesion proteins called as paxillin, and we see that there is no difference in size of the focal adhesion or the number of focal adhesions. But when cells were transfected with focal adhesion proteins known as paxillin, and when we look at the focal adhesion turnover, we see that under no glucose condition, focal adhesions are stable. So that is why we depict that the morphology or the spread morphology under no glucose condition is because of the stability of focal adhesions. So the next question we asked, why cells are migrating highly under no glucose condition, and we thought that cells under no glucose condition might be elevating mitochondrial activity by elevated oxidative phosphorylation, and that is what we observed. So then we looked at the mitochondrial membrane potential, and we found that there is higher mitochondrial membrane potential under no glucose condition. On inhibition of mitochondrial activity, not only the cell speed area but the cell speed decreases under no glucose condition. So this indicated that under no glucose condition, oxidative phosphorylation or mitochondrial activity sustains the cellular phenotype. So next, there are observations related to the invasion plasticity in cancer cells. So cancer cells migrate with the two distinct migration modes known as mesenchymal migration and amyloidal migration. So with the mesenchymal migration mode, cells secrete matrix metalloproteases that degrade the extracellular matrix and cell can migrate through it. Whereas in amyloidal mode of migration, they create cells squeeze through the dense matrix and cells follow the path of least resistance and they migrate through the path. So we looked at the proteolytic mode of migration by looking at profile of MMP2 and MMP9. MMP stands for matrix metalloproteases, which are secreted highly in MDMB231. We observed that under no glucose condition, the secretion level at the RT-PCR, or we can say that at the mRNA level, there was less expression of MMP2 and 9. Similarly, we found MMP levels were lower at the protein levels under low and no glucose condition. When cells were seeded for 24 hours and the conditioned media was collected, so the conditioned media will contain the secreted MMP9 or 2 levels. And when they were loaded on a gelatin gel, we could see that the activated MMP9 were lesser in no glucose condition. When we inhibited MMP's activity with the drug sp3CT, we see a significant drop in migration speed under high glucose condition compared to no glucose condition. Next, we generated MMP9 knockdown cells, and we found that cell speed was significantly lesser in high glucose condition compared to no glucose. So this indicated that in presence of glucose, cells tends to use proteolytic mode of migration. So the next question we asked, what is the mode of migration under no glucose condition? We did gel compaction assay in which cells were seeded in higher density under high and no glucose condition, and then they were allowed to pull with the help of contractile forces on the surface, and they were allowed to pull the gels. And we found that am I audible?
Yes, you are audible, Vividha.
I thought I got disconnected. Yeah. So with the help of gel compaction assay, we found that the cells in no glucose condition are less contract. Then to confirm this observation, we did the protein expression assay by staining PMLC, and with the help of Western blotting, we found that PMLC levels under no glucose condition were less. So this indicated that cells are less contractile under no glucose condition. Next, we stain cells with lamin EC, which stains which is a nuclear protein localized in the perinuclear area. We looked at the nuclear height and area, but we did not see any statistical difference under high and low condition. But we found some change or decrease in the lamin EC intensity under no conditions. So this was an indicator that cells might be softer under no condition. Then, with the help of atomic force microscopy, that is AFM, we looked at the cortical stiffness of the cell and the nuclear stiffness of the cell. So we found that under no glucose condition, both the cells as well as the nucleus are softer. So this clearly indicated that under no glucose conditions, cells are using non-proteolytic mode of migration via nuclear and cell softening. So next question we raise: what are the regulators of this choice of mode of migration? So we hypothesize that metabolic constants dictate this mode of migration. So this was a key observation from previous part, that on 3D surface, or in case of 3D matrix, cells under no glucose condition are not, even under the control conditions, are not migrating very well. So this indicated that, and the migration under 3D matrix is more energy consuming than the 2D matrix. So we thought that this might be related to the energy status of the cell under high and low glucose conditions. So we co-transfected cells with the Percival HR and pH rate, so which will give us live ATP to ADP levels. Percival HR is a fluorophore, but it is pH sensitive, and so we co-transfected cells with Percival HR and pH rate. So what we have observed that under high glucose conditions, ATP to ADP levels were significantly higher as compared to the no glucose conditions. When cells were treated with sp3CT, which is an inhibitor of proteolytic mode of migration, we found that ATP to ADP levels go down significantly under high glucose condition. But that is not the case for no glucose condition. When cells are treated with cis-CT, which is an inhibitor of oxidative phosphorylation, we see there is a significant drop. So it indicated that non-proteolytic mode of migration costs less energy. Alternatively, it shows that under no glucose conditions, cells migrate with optimum amount of energy levels. So next question we asked, how does ATP to ADP ratio is calculated? So as we know that phospho-AMPK or activated AMPK expression increases under the stress, and under nutrient stress or energy stress, we can say in case of no glucose condition, AMPK levels increases. When we stain cells with phospho-AMPK under high and low glucose condition, we see there is a differential localization of phospho-AMPK under no glucose condition. When we treated cells with compound C, which is an inhibitor of AMPK, we see that there is significant drop in cell speed under no glucose condition. So next question, how does AMPK regulate migration under no glucose condition? So AMPK is known to regulate different mechanistic protein, and one of the key protein is actinin 4. So next we looked at the actinin 4 levels inside the cell, and we found that under no glucose condition, there's differential localization of actinin 4, which is perinuclear, whereas in high glucose condition, actinin 4 is localized to the periphery of the cells. So next we check the actinin 4 levels in high and low glucose condition. We found that alpha actinin 4 levels were higher under low glucose condition compared to high glucose condition, which is also represented with the mRNA levels inside the cell. When we knock down actinin 4 cells, we found that there is significant drop in cell speed under low glucose conditions. So this indicates that both AMPK as well as actinin 4 are important for cell migration in low glucose conditions. So next what we do, the previous part of this studies were carried on cancer cell line. Next what we did, we derived cell or single cell population from the patient sample, which is a TNBC patient. From the tissue sample, we homogenize the tissue, and then the small chunk of the tissue was treated with collagenase, and single cell population was taken. Then this population was stemmed for the actinic 4, and we found that under low glucose condition there is increased expression of actinic 4. And we found that the data of actinic 4 expression as well as migration was similar to the cell line expressions. So next, we wanted to probe how does AMPK regulates actinic 4 at the translational level. So we locked down AMPK and we looked at the actinic 4 expression, and we found that in AMPK knockdown cell, actinic 4 expression goes down. So this indicated that AMPK somehow regulates actinic 4 expression. So now we wanted to look at whether this regulation is at the transcript level or not. We performed chip PCR. So in the chip PCR assay, the protein which is linked to the DNA, so whether some protein is regulating expression of some gene, that this information can be gotten with the help of chip PCR. So we perform chip PCR for actinic 4 promoter region for AMPK binding. So this blue is, you can consider as this is the AMPK, and the gene region which is it is attaching, it has attached to the gene region can be considered as actinic 4 promoter region. Next, what we found that after doing the chip PCR, we found that AMPK enrichment was found to be significantly higher under no glucose condition and the actinic 4 promoter region compared to high and low glucose condition. So this clearly indicates that AMPK is regulating actinic 4 expression at the transcript level, and this regulation is elevated under no glucose condition. So we propose this model that as glucose is less or glucose is not present in the media, AMP gets activated, and which in turn regulates actinic 4 at the transcript level and dictates the mode of migration, that is amoeboidal or non-proteolytic mode of migration under no glucose condition, where we could see that there is elevated oxidative phosphorylation. Whereas under high glucose condition, cell migrate via proteolytic mode of migration by elevating expression of LMP9, which degrades the extracellular matrix, and cells can migrate very easily. Thank you.
Thank you, Vividha. We can take a couple of questions for this session. Anyone who is having any question? I think there are no questions.
Ma'am.
Yes, there is one question. Yes, you may go ahead.
Good afternoon, ma'am.
Hello.
Hello, good afternoon, ma'am. Am I audible?
Yeah.
Yes, Noora, you are audible. Please go ahead with your question.
Ma'am, initially during your presentation, you have said that cancer is it can transfer from like one organ to another. Like, is it possible for us to do things on a regular basis to stop this process, or it is like only after a diagnosis we can know that we can do the other processes, like how we can stop the transfer of cancer cell from one organ to another? Is it like after diagnosis or before itself can we start as a precaution? Is that possible?
So
we are just
So
at the end of
the
meeting.
cancer cells
झालंय
or the
इथं
primary
ऑफिसर
cells,
पब्लिसिटी
primary
तर ते
tissue invasion
कम्प्लीट
happens
ऑफिसरच्या समोर आहे
once
ना
the
तिथं बसून
tumor
कंटिन्यू
size is grown fully.
जातो का
And
परत
then
तिथंच ठेवतो
once
ऑफिसरला
one cancer can be is
म्हणजे तिथं
detected, then it can
पुरुषच
the
बाहेर
cells
आणायचे
can
पुरुष आमच्या बाहेर
travel via
हां
bloodstream to the other organ.
प्लीज
So
झालं
I think that
थँक्यू
the doctors will be the appropriate judge for this question, I guess. But whatever I have found
गेटमध्येच आहे
during literature survey in during my PhD, I think it can be found after diagnosing one cancer.
Okay, ma'am. Thank you.
Yes, Nandana, do you have any question? You have raised your hand. Any other questions? We can take one more question if there are any.
Yes, may I, ma'am?
Yes, please go ahead.
Yes, sir.
Ma'am, you said that in the blood vessels, some cancer cells are transferring from one cell to the another cell, and it is going on. So, and you suggested one model. So, after how many trials you concluded this model,
So this is
and
study
what is the success
that
ratio of this model?
so this is the study performed in particular cancer cell line, that is NDMB231 cancer cells. So and the observations were similar with the patient sample, TNBC patient sample. So I would say that it is relevant to the TNBC breast cancer cells.
It is relevant with.
TNBC breast cancer cells, triple negative breast cancer cells.
Okay.
Her work is majorly on breast cancer cells.
Yes.
Yeah.
Yes.
Thank you, ma'am.
Thank you.
I think someone named Arif wanted to ask some question. You raised your hand.
Yeah, am I audible, ma'am?
Yes, please go ahead,
Yes.
Arif.
Ma'am, as per your opinion, which molecular biology method will be the best for early detection of cancer, like isolation of cell-free DNA? And also, one more question is, what will be the future of molecular biology in cancer research? Thank you.
So cancer research is mainly molecular biology research only, and the biomarkers which we detect are there are different studies going on the cancer cells, different patient samples, different cohorts from different region of the patients. So all the molecular biology like techniques like RT-PCR, now single cell RNA sequencing is being like majorly focused by the cancer researchers. So these techniques can give you the like most relevant insight for detecting early markers of the cancer.
Thank you so much, ma'am.
Thank you, Arif. Anyone else? Nandana, your hand is still raised. Are you willing to ask any question? All right, I think with this we can stop this session. Vividha, at the outset, let me express my gratitude for accepting my invitation. Even though you are so much packed with your presentation, which would be scheduled anytime, I can still see a bag which is there beside you, and you have to rush to your work. So to conclude this session, I, on behalf of the organizers and participants, express our thanks to Vividha ma'am for her insightful presentation and catalyzing research aptitude among all of us. Your research has an indelible mark in the field of cancer biology. Thank you once again for sharing your cutting-edge research in breast cancer.
Thank you.
Vividha, thank you
Thank
once
you.
again.
Just one small request to all the participants. Just at the end of this session, kindly make on your cameras so that we can take the screenshot of all your presence. So at the end, kindly make on your cameras. Ma'am, you can continue now. Pooja ma'am.
Yes, ma'am. As we move towards the end of our session, we come to a realization that knowledge indeed has no end. Today, we witness an information symphony that will undoubtedly value add to each of our professional and personal lives. For that, I propose my vote of thanks and express our deep sense of gratitude towards our esteemed speakers who humbly accepted our invitation and effectively served the purpose of cancer awareness and research. I, on behalf of the organizing committee, convey deep regards and hearty thanks to our Honorable Director, Professor Satpute sir, who has always encouraged us to host such events. Thank you once again for motivating us to keep conducting such events, sir. Also, without the support and guidance of our head of the department, Mr. Harris Panakal, sir, this program would have not been possible. Thank you, sir, for minutely detailing every bit of the event. On behalf of our Government Institute of Science whole fraternity, I further extend our sincere appreciation towards Dr. Pramod Kamble sir for his timely support in helping us in bringing this event on a national level platform. Thank you once again, sir. I also thank our coordinator, Dr. Mayawati Patil ma'am, for taking the responsibility and conducting this event on a virtual platform. Thank you, ma'am. Last but not the least, this is a personal note to all the participants that without you all, care would have not been possible. Thank you for your active participation. And the overwhelming response previously also I have texted in the group, the overwhelming response with which we have received 214 participants across our nation has raised our hopes to further conduct such events and reach out to maximum all of you. You all indeed has been quintessential element of this event that has uplifted our spirits to do better in the future. Thank you to all the participants once again. Finally, I express my thanks to all the teaching and non-teaching staff members who have supported in conducting this event. Thank you once again to all. And before we close, I would like to remind everyone to share your feedback with us. That is going to be helping us to do better in the future. And the link will be shared very soon by 5 p.m. today. So everyone is requested to share your feedback. And your e-certificates possibly will be received, will be dispatched, I think, next week.
Next week, yeah.
Okay.
Next week, yeah.
Meanwhile, if anybody has anything to be asked, you all can raise your question, or else we'll close this session here itself.
Yeah.
All right.
Yes.
So I think we'll stop here. We'll close this session now. And thank you to all once again.
Yeah, just wait. Kindly make on your camera so that we can have a screenshot of our virtual event.
Yes.
Thank you, sir. Thank you, sir.
My camera, wait, ma'am. I don't know what happened today.
On mobile.
Thank you, Pooja madam.
Yes, sir. Thank you, Pramod sir. Thank you very much for your support.
Welcome.
I think most of the participants. Okay, sir. We have taken the attendance and we have taken the reports from all the participants. So, okay. Thank you. Thank you very much, all the participants.
Thank you all. Thank you. Can I leave, madam?
Yeah,
Yes.
yeah, sure.
Thank you very much, sir.
Thank you.
Okay.
आता